Welcome. It's great to see everyone this evening. Unfortunately, I think there is some seasonal sickness making its rounds other than COVID. So I've heard from a few folks this week that won't be able to join us. And I do just want to say in advance, I am getting over that sickness. So today I've only coughed once, but I don't want to alarm anyone. I do not have COVID. I have been tested and cleared, but just to share that reassurance. So welcome. So tonight we have a full agenda of mostly work group reports that I'm really excited to hear, this on the ground work that's starting to happen. Before we get to those reports, we'll go over some business items of approving the minutes from our last meeting, doing roll, and then we have a few minutes of updates. I also want to apologize. Your agenda in front of you has my notes. Because, again, there were some folks out, we did not get our copies made. They were not waiting for us here, but we're able to make copies, but I already made my chicken scratches on the agenda. But you do have the agenda in front of you, and maybe you'll find my notes helpful to you as well. So apologize for the not very clear handwriting, though. So welcome. Did folks have an opportunity to review the minutes from our September 3rd meeting? And is there a motion to approve? Okay, thank you. Thank you, Alderman Sutton. Thank you. All right, and I'll just do roll call here, and then we'll get rolling on our work group reports. Chief Adams. Julia. Not seeing Julia online yet. Nathan did join us. Wonderful. Welcome. And I would like to welcome to the task force Miss Wanda Brooks. She will be joining us in replacement of Mr. Reese, who resigned from the task force. So we'd like to offer a warm welcome. Thank you, Wanda, for joining us. Dell? Okay. Nathan, I see you joining us by Zoom. Sheriff Christopher? Bob? Patsy is joining us online. Commissioner Inslee? Thank you. Carrie? Here. Bill? And I know Mandy won't be with us this evening, or Laura. John Lynn, I see you online. Yes. And I think Nice might be joining us online, so we'll watch for that. I see another caller joining us online. If that happens to be Nice, if you could put in the chat that you're present. Linda and Teresa will not be joining us. Jocelyn, Alderman Sutton, and Brandon had another commitment. So welcome, everyone. For the purposes of our Zoom audience to be able to hear us, I would like to propose that our work group leads come to the front and speak when they're giving their reports, if folks are comfortable with that. I will physically distance myself to the back of the room while we invite folks up. As you can see on my handwritten notes on the agenda, I do have the order of the work groups. So community connections, with Carrie delivering that report, will start us off, followed by economic stability. That report will be delivered by Alderman Sutton. Education, and I wasn't sure, Bob, Patsy, if who will be giving us that report. You are okay. Thank you, Bob. Eviction, I think Brandon was hoping that Commissioner Inslee might be able to give us an update. Okay. Vicki is not here yet. She has been joining us online, but I don't see her yet. And then Health with Julia. And I see that Julia has joined us through Zoom. So we will be glad to hear whatever you want to share with us. I do have some prompts down here for us. So we'd like to know when you met, if you'd like to share who is attending and participating in your particular work group, a brief summary of what your agenda was for the first meeting, and if you have identified any next steps. To be fair and to make sure we have time for all the work groups to report out, I am asking that we keep that report around 5 minutes. And I hope it's not too rude that if I set the timer on my phone to try to keep us on track. Is that okay with everyone? Okay. So with that, I'll exit up here and I will welcome Carrie to the front. If you would sit here or just close enough to the microphone, Carrie, where they could hear you. Thank you. Mm-hmm.
All right. I'm Carrie Guidry. I'm the Senior Case Manager at the Haywood Pathways Center. Worked there for about 3.5 years. I am the lead for the Community and Social Connections Work Group. We met on September 17th from 6 to 7 at First United Methodist Church in Waynesville. Present was myself, Mandy Haithcox, the Executive Director of Pathways, Nathan Cartwright, and those are the task force members that were present. Dale was unable to attend because of the storms and the electrical issues. And then we've added Michael Blackburn, who's a community member and also from First United Methodist Church. We reached out to Jonathan Wood unsuccessfully. And then our alderman is Alderman Feichter, and he was also not able to attend that meeting. So for our first meeting, we read through kind of what the focus of our work group includes, which is homeowner support systems and resources, so where are those gaps, and social cohesion, as well as the social determinants of health related to our work group. We shared communication with the community as a pretty important part of our work group, especially during COVID, with more people being at home and other activities that are not occurring. Those experiencing homelessness have become a little bit more visible. Also, we determined, some of the cause of that is the open door is not open anymore. And a lot of vacant buildings that sometimes kind of hid some of those homeless folks because we didn't realize they were inside have been torn down or shuttered. And we also think that the messaging is very important in regards to what our next steps are. We thought about, are there other places where the marriage between community and the needs of the homeless population has been successful? So kind of like a housing first model. Where has that worked? What did they do and why did it work? And we discussed gathering data on those communities. And then, of course, acknowledging that there are populations that aren't kind of what you think of when you think of homeless. So that could be small children and families. It could be a single mom with 4 jobs. It's not necessarily the stereotypical drug user that has multiple felonies. So our decision was made to start our focus on the support systems because we feel that that's going to be the easiest to quickly gather the information on because we kind of work with the folks every day, linking them to services, and we can immediately identify multiple gaps and then work on the rest of those gaps. We think that it's important to figure out how many evictions haven't made it to the court process. So when you think of evictions and you get those statistics, it's the ones who went through the court system. But where are the folks that didn't make it to court, but they did have to move out because they couldn't pay their rent because of COVID or childcare issues, things like that? We'd like to know what those numbers are. We'd also like to really work in identifying the gaps with mental health needs that are going unaddressed. And if there's a community mental health services provider that we could add to our group so that we understand what those gaps are better. We wanted to also look into the lack of detox facilities and inpatient treatment centers longer than 30 days locally because we don't have those. And we talked about having various entry points along a continuing of housing services, which would be everything from a low barrier shelter to permanent housing. So we did identify that it is most likely necessary, and we'll later say necessary when we have more information, that low barrier shelter is a step that needs to be put into place in Haywood County in order to successfully move folks along that continuum of care. We want to identify unmet shelter needs in populations to include individuals that are currently under the influence of alcohol and drugs and thus cannot stay at the current shelter. Mental health needs, so those folks that are in danger to themselves or others or at a level with their mental health status that they can't successfully stay in the current shelter that we have because of the rules and things like that. Families aside from moms with children, because we do have resources for moms with kids, so single dads, families with moms and dads that are not willing to put the dad in the male shelter and the mom in the family shelter, and also families that are LGBTQ families or trans that don't have resources. Elderly with disabilities and medical care issues that can't care for themselves, but they also maybe don't have the insurance to go into an assisted living or a nursing home. So what happens with those folks? Registered sex offenders, unaccompanied youth, criminal charges that we can't take at pathways like murder, rape, and undocumented individuals. So we're going to create a questionnaire to go around to some of the homeless folks that we know and to get a little bit of information that way. Research, like I said, Housing First and how it's worked in other communities, and also discuss federal state dollars available for housing and shelter via the Emergency Solutions Grant and how that could assist with facilitating something like a day program or a low barrier shelter. So that's where we got. Our next meeting is October 15th at 6 p.m. and we haven't decided a location, but my guess is that we'll probably be at First United Methodist again because they're really kind people and they have a lot of space. No problem. Thank you. Sorry, I talked for a while.
You can have some of my time if you'd like.
No.
It feels odd to have my mask down in front of people. My name's Anthony Sutton. I'm one of the aldermen for the town of Waynesville. My group is the Economic Stability Work Group. It consists of Chief Adams, Sheriff Christopher, John Lynn McDermott, Jocelyn Schaefer, myself, CC Hips, who is the president of the Haywood Chamber of Commerce, John Larson, who owns Hazelwood Soap Company, and Tyler Trentham, who's a lieutenant with the police department. We have also invited Brian Cagle and Stephanie Sutton to join our group. So we have a very large group, diverse in business and in law enforcement. We met on September the 15th at Grace from 2 to 3 o'clock. Our next meeting is going to be September the 29th, and we're going to meet at the Bethel Resource Center. What our group talked about was the impact of homelessness on business. CC Hips is currently working on a questionnaire that's going to go out to the businesses. We also talked about the impact of homelessness on businesses and determined that law enforcement can clarify that loitering is not a crime and that folks can be asked to move from public places, but unless the jurisdiction has a low barrier shelter, we can't have anywhere for them to go. So low barrier shelter came up in our group as well, and the need for a low barrier shelter. The group did have one major area that they wanted to take action on immediately, which is a point in time count of all the homeless in the area. And we're hoping that we can coordinate with the other groups and get a point in time count immediately. Yes, Carrie.
There's a point in time count every January. So you have the numbers from last January, and we'll have it again this January. That's already like
Okay.
in place. I don't know if that's helpful to you.
Yes, that would be very helpful to us. We'd also like to collect research from other municipalities about the effectiveness of low barrier shelters, specifically the cost benefit analysis and health outcomes. And we'd also like data from the de facto low barrier shelter that was put in place in Maggie Valley this summer to see the benefits. We also learned about self-service resistant for people that don't want help, but don't want supportive help or case management services. We also learned about the Bethel Resource Center on North Main Street that will provide some of the services open door used in Frog Level, and our next meeting will be there. And that sums it all up. Thanks. Did I do 3 minutes?
Can I have one thing?
Yes.
I have a whole paper, I'm sorry.
I know, I said.
One of their other next steps, which is really important, so I wanted to mention it because people might know people. But we want to invite some homeowners from Hazelwood, Frog Level, Allen Street neighborhoods, not like 50, so it can be manageable, but folks that are willing to have a discussion and receptive to helping homeless folks, but also have experienced issues and concerns so that we can have a better idea of what that is. That was important because you guys might know people that you could tell me.
Yeah, and I will just add, so unfortunately I shared that I have been sick with a cold, and I had a meeting set up with Alderman Pfeiffer that I had to move, and we are planning a focus group with those individuals. Let's connect on that.
Okay.
Carrie, thank you.
Put in my time, Carrie.
I know, but I love you, Mom.
I love you.
I shared some of mine. I only took 3 minutes.
Oh, okay, good. Thank you. I'm Bob Cummings. I'm a resident of Hazelwood and a proud member of this task force. I'm on the education prevention group, and Patsy Davis and I are on that. Unfortunately, because of schedules, we've not been able to physically meet yet. We have a meeting planned for this coming Monday at 7:45 a.m. So we're going to do this. We did meet on the telephone and talked a bit. We discussed the fact that education is a pretty wide spectrum. And I think she was looking at education. Part of her plans and part of her heart desire is to educate the homeless population with everything from how to get a bank account, how to rent a place, how to leave a place when you rent it, how to budget, those kinds of things. I know a lot of that, or some of that's being done at Pathways already with Dmitry Chertikov from for Citizens Bank comes out periodically and does a budgeting and a banking class. My background is in substance abuse prevention. So when I say education, I'm thinking automatically going into the schools and working with kids and doing something on the long term, because if we start with junior high or high school kids and do substance abuse prevention, they're that much less likely to end up in a homeless situation. Or if we do, for instance, the curriculum I used to teach called Safe Dates about dating abuse, which then leads to spousal abuse and so on, which then leads to homelessness, et cetera. If we can start at that age, then hopefully we can waylay a lot of the problems that we're dealing with now. So when she and I actually get together Monday, we're somehow going to try and pull this long spectrum together into what can we actually do here in Waynesville in the area of prevention. So next time we'll have a better picture for you. Anyway, I apologize that we have not met yet. We have really tried, but between my schedule and her, it's just not been possible.
I appreciate that, Bob, and I think it's wonderful that as many of the work groups were able to get on the ground and run, but I don't want folks to feel like your efforts are delayed, because I don't think they are. And we also were able to add older people and the mayor to many of our work groups, and because of timing, they have not yet been able to join in. So I think we're just slowly getting ramped up here, and I think everybody should feel good about their efforts
Super.
today.
I feel better. Thank you.
Uh,
Yes,
I
sir.
think Alderman Dixon is going to be joining your group.
Okay. Neat. Super.
He's on vacation. He's going on vacation.
Okay.
Okay.
You are next, Commissioner Inslee. Thank you. I started your clock on you before you got up there. Yeah, I was quick on that clock.
But do you have a clock somewhere? He's used to that little light.
That's right. I'm kind of lenient, though. I always let people talk longer than they should.
Which is okay.
Hey, everybody online. Okay, we met on September 17th at about at 4 o'clock. We did a Zoom meeting, and so it was. And I wish Brandon and Vicki were here to tell. Oh, Vicki is here. Vicki, do you want to give us a report?
No, go ahead.
Okay. She could probably fill in the gaps for me, Vicki, because so we identified, we wanted to identify some resources that were available for renters that's possible out in the community. And so we identified, Brandon, I think he said it before, that ABCCEM, which is where he works, he had gotten quite a bit of federal money for veterans. And then we identified the, let's see, Disability Partners and Mountain Projects, and then Salvation Army as resources for possible rent. We had also, and then of course Pathways, and I wanted to say also we had Steve Nowakowski there from Haywood Christian Ministries, and he talked about that mostly what they're doing now is food distribution. Used to, they did quite a bit in the heating realm for people. That's kind of what they specialized on, along with the food. But since COVID has hit, they've mostly been doing food because they've got really a good setup for that with Manna. And they have refrigerators, and they've revamped their bottom floor of their building to be able to help people. And what he's found is when Haywood and I used to be on that board, and so I know, when they started taking care of the food issues that people had in the community, they found that their rental assistance, their utility assistance went down because people had more money. The money that they were getting the food, and they didn't have to spend on food, they could use on their other bills. So we've seen that happen, which was kind of surprising, I think, to us. And we also had Michelle Rogers at our meeting, and you know, she has a perspective because she manages 375 rentals out in the county. And so she works with landlords and renters to try to make sure the mortgages are paid. And she said she's only had about a 1% eviction or you know, having to evict people. And of course they weren't able to do that for a while, but she kind of gave us kind of a background on how to, on what she deals with every day. And one thing we need to remember with a lot of people that have rentals are that these people are usually have mortgages on their homes. And so they're needing the income from the rentals to pay mortgages or whatever bills that they have. So it's not like it's somebody that's just, it's an investment for them. I'm sure some are, but a lot of them have mortgages, and so they can't really just bypass the rent. So she told us of ways where she works with clients to try to help the landlord and the renters, you know, maybe, and then she'll refer them to other people. I mean, to other, you know, like Salvation Army or Haywood Christian Ministries or Mountain Projects to be able to help with their rent. So, and she talked about how they deal with that and everything. So it was pretty good. We're going to meet again. I don't think we set a date, did we, Vicki? I was looking at, I think we were going to set a date after this, and that's pretty much what we talked about. So, Vicki, do I need to add anything?
No, so what I passed out is the flyer from Legal Aid. Currently, the CDC has a moratorium on evictions, okay? So I passed out the flyer from Legal Aid. Remember, Suzanne Saucier was here and gave us an update. So that's the flyer from Legal Aid with their number on it. Then I've actually passed out the declaration that they would have to sign in order to be eligible for that moratorium. Part of that declaration says that they have to have looked for help paying their rent. So that's why we developed that housing resource assistance list. And that's what we're talking about with the Veteran Services, Disability Partners, Mountain Projects, and Salvation Army are on that list. So we wanted you guys to look at this and see if there's anything else you wanted us to put on that list that you know of that has money to help with paying back rent, okay? And let us know about that. And what Kevin is telling you is that normally people would say Haywood Christian Ministries, but since the pandemic, they've been focused solely on food and getting food out to people. So they are not quite ready yet to be put on a list and start doing rent assistance. And we don't want to put their name out there until they're up and going for that, okay? But we will certainly add Haywood Christian Ministries on. That's my time.
Don't let it cut you off. There's anything else you need.
So if anybody had any comments on that housing resource list that we've compiled, we would love to hear from you. And then also our other project is crisis, and that housing resource list sort of goes to crisis. And then the other part of our committee is winter prep. And we are still brainstorming on that, and we really need input if anybody has any ideas about what to do this winter. You know, yeah. So remember, because when it gets down below 32, it used to be last year that people would sleep on the dining hall floor of Pathways or in church fellowship halls. Yeah, if I don't know with the COVID, that's so, okay, so we'll talk more about that, but we do want to talk about winter prep. Thank you.
Thank you, Vicki. If I could just add to Vicki, so Hannah has also been working on a resource list for evictions, and you have that in front of you as well. We can combine those documents, and she's been doing that in collaboration with Suzanne. So let us know too, like if we're missing anyone on that list. And we also wanted to let Mountain Projects take a look at that and make sure they're okay with being listed on that document.
Can I ask a quick question?
Yes.
Am I understanding correctly that there's a gap right now in terms of helping people pay heat bills? Because I think people turned on their heat this weekend.
There should not be. People should call, right now should call DSS.
Yes, okay.
And there's two programs at DSS. One is called LIHEAP, which is Low Income Energy Assistance Program. But there's also crisis money. We're in a crisis with the pandemic. So DSS can activate that crisis money. And LIHEAP is typically, you think about people going in December and getting the money for their heating oil and stuff like that. But they should contact DSS first. Okay. And if it's due to COVID, Mountain Projects has the CARES Act money. So if DSS says no, they should contact Mountain Projects or Salvation Army or other places. Yes. But what you're saying is what Kevin referred to is that a lot of times you have to choose to pay your heating bill or your rent. And if they can get money to pay their heating, they can use their money on their rent, right?
Or they can get food.
Or they can get food, and we have tons of food in Haywood County.
The food's really helped people. I mean,
We gave away, we started First Methodist yesterday to get a food distribution in partnership with Manna. We served 180 families, 580 individuals, and we ran out of food. So we've got food coming in Haywood. Food is in Haywood County. I'm happy to forward you that food resource.
Yeah, Vic, if there's anything you want to forward on to me and I can push it out, we would be happy to do that.
And the week before that, we did Pigeon Center food. So, and that was around the same number. So we're doing food distributions all the time in Haywood County. So there is food here. And I will forward to Amy the food resource guide that is updated weekly. And then people will know where to go for food. Is that okay?
Yes, thank you. Oh, thank you. So Julia is joining us through Zoom, and she is going to give us the report from the health work group. Thank you, Julia.
Hi, everybody.
Turn you up here, Julia. Oh, can you hear
myself?
Oh, maybe I need to do it here. Is it going up or is it keep?
it was going up.
Okay.
But it's on mute.
How is it now?
You're still really light for us. So I hit the volume and it turns to mute.
Do you want me to keep talking as a test? Just keep saying things so you can decide if you can hear me or not.
I'm all the way up on mine.
This has a really good volume.
Okay, give us 1 second, Julia.
Sure.
Yeah. Do you have the registration? Okay. This troubleshooting.
Technological difficulties.
Oh, we can't hear you at all now. Oh, did I mute? That was me. That was user error.
How about now?
I'm very familiar with user error.
Me too.
Is that one off?
When you're hitting that.
I can't see. Is it doing both of them?
It's doing this one over here too. Okay.
Okay, there we go. I'm not touching it again. Maybe.
You did go up one. Oh.
You went from 11 to 12, I think.
Yeah, every time. So when I hit, and somebody can tell me, but I'm hitting the volume in it. So when I hit it, it moves to mute.
Oh. Is that like your second hit? It's going up?
Yeah, it's either mute or 11.
Is 11 loud enough or not loud enough?
So okay, want to get it started and then we'll, okay. We will listen very intently.
Okay, does
Julia.
it help if I talk louder?
Yeah.
Okay, I'll talk loud. So the health working group met on September 16th from 5 to 6 over at one of the covered pavilions near the park. And in attendance, we had myself, Ronnie Johnson, Billy Simmers, Hannah Minnick, Sean Hudson, Jesse Lee Dunlap, and Casey Valentine. I don't think I missed anybody, but if I did, let me know. So we spent a little bit of time just getting to know each other and why we were interested in this group. And, you know, reminded us all that we are defining health very broadly to include physical health, mental health, and substance use challenges. And we started out just with a conversation about what are some of the gaps we already know are a problem in providing health to folks who are homeless, healthcare to folks who are homeless. And so the main barriers or the main gaps we definitely know about already are that there's a gap people fall into when they're discharged from jail and prison, that there's not always a good plan, especially if they are incarcerated outside of Haywood County but came from Haywood County originally. There's a tendency that those folks just kind of get dropped off at the courthouse door, and which is a problem for accessing resources, but also for folks who are on probation and need to have an address or a residence within a certain time frame. They're at high risk of being reincarcerated. There is a lack of some of the mental health services that used to exist in Haywood County with the closing of the behavioral health urgent care that used to be up at Balsam Center. And that we had some input from Casey and Jesse Lee, who helped with the low barrier shelter over the summer, reporting that when someone really needed services, it was hard to get them in places. That if they needed something urgently, they were told they needed an assessment, and then there was a waiting period for an assessment. And so there's something missing there that we're going to look into more. And then transportation, as always, is a barrier in our area. And we have low barrier shelter on ours as well that we wanted to learn a lot more about what went well during that experiment. But we aren't sure if that falls into our category, and I heard multiple other groups mentioning it as well. So really we sort of brainstormed those gaps and then identified who are the providers in our area that we'd like to know more about. And so we broke up the group with assignments to gather a lot of data and bring back what we can get for next meeting so that we can decide, do we have enough data to start making brainstorms and ideas and suggestions, or what other data do we need? So we plan to gather information from, the local mental health agency providers, the local substance use providers, and the local healthcare providers, medical healthcare providers who tend to see folks who are homeless, in addition to trying to gather some data about how many homeless folks are served at those places currently, with a special attention to the fact that the emergency department might be doing a lot of the things that if someone were not homeless and had insurance, they might be getting somewhere else. I think that is another gap that was identified by the folks who were involved with the low barrier shelter is just a lack of transitional housing in our area. So a place that someone could stay a little more stably and a little more long-term than a shelter, as they are getting everything in, ducks in a row, getting feet under them in a job or in some other arrangement where they could then afford their own housing. And just as an aside, I used to work in Massachusetts, where they had something amazing called the Massachusetts Standardized Documentation Process or Project, which I'm going to do a little more research about how they got that going. But the nice thing about that is that if you had a comprehensive clinical assessment at one agency, it was the same form as every other agency that subscribed to that project. And that reduced a lot of barriers. So the things that folks are noticing is, someone wants to get an assessment at Meridian, they go get an assessment, but then they need an assessment for a different service and they have to do another assessment. They can't just take one assessment from one place to another and get easier access to services in that way. I think that is the main gist of what we did. Like I said, we're all tasked with some data that we think we can get fairly easily to bring back to our next meeting. We had originally scheduled our meeting for Thursday, October 1st, but there's a conflict with another group that is meeting that day that a lot of our members want to go to. So we are currently working on finding another date, which will probably be either a different day next week or another date the week of our next big group meeting, but before we meet. So we're working on that date right now.
Thank you, Julia.
There's a question in the chat, and I don't know the answer to that question. It says, how long is a low barrier stay, or is there no limit?
Low barrier shelter, generally speaking, it's in that day, and then like in the afternoon around dinner time, stay overnight, out the next day. Most shelters do it that way, but if they do low barrier shelter where you can stay longer, they usually just do it to stabilize that person and move them into another program, kind of like pathways. So that's why I said multiple entry points along a continuum of care, because if you have a day shelter, which is just like kind of what Open Door was doing, they can move them to a low barrier shelter. They can stabilize and move them to pathways or something like pathways. They can get them stable enough long-term, 6 months or so, to move transitional housing and transitional housing to long-term care. So that's what I meant by multiple entry points on a continuum of care.
Did you all hear that? Julia, did you hear that online a little bit? Okay, I'm going to try my best to summarize. Generally, a low barrier shelter is only going to be a 24-hour stay, because the goal is to try to get someone into a more stable, permanent housing situation, depending on what that particular person needs. Somebody might need a lot of support. Other folks may just need housing in front of them. So, and what Carrie was describing is what we call a housing continuum of care. So you move from that continuum from very intensive supports to less restrictive, more supportive, less subsidy along the way. And the rules, in my experience, will vary. And so there are different models. There are some with low barrier that are very restrictive, and punitive. And then there are others that very much embrace a housing first approach, John Lynn, that it's all about getting someone into housing because that research has demonstrated you get someone stable, then it's easier to get the rest of their world stable. So it really ranges that whole intervention. So we would get to decide as a community what that looks like. The research is pretty comprehensive on a housing first model in terms of not only providing humane care, but also the return on investment. It just costs a lot less to get folks stabilized, and then they generally need less supports. But that does seem to be a common theme. So I don't necessarily want to drive the rest of this discussion. We've got time to have some discussion and questions about what we heard from each of the work groups. I do want to ask the question about where do we think that issue belongs in the work groups, or do you all want to assign that research to me and Hannah, and we can go and pull that information, look at it comprehensively, and then piece out to each of the work groups relevant information. So I think let's think about economy of scale here too. What can we take on from the work groups, and what do y'all want to do on your own? We probably can't answer all those questions here, but please be in contact with us to say, we're going to handle this piece. Could y'all take this piece on? And I do want to apologize. It was my intention to attend most of your work groups these past couple of weeks. Some of you have already heard I've been quite sick and was not able to do that. So I will be dropping in to try to make sure I'm sharing information across work groups as well. So I hope to see you soon. So I would just want to open up for questions.
I forgot one thing from our work group was there was some interest in our health working group about whether we might collaborate about the cold weather winter preparation conversation, because there's a very strong correlation between unsheltered folks in the winter and health.
Would it be okay? I think that to me that connection is between Julia, you, and Vicki.
We do the cold weather shelter.
Okay, so if I can get y'all started on an email, Julia, Carrie, and Vicki, and start the conversation from there. Okay.
When the low barrier shelter you
I don't have a date on that, but they had pushed it into July and August. I think the 1st of August, they had got funding through other, like Helping Hands of Haywood and then some private donations. And so what they did was they had, let's say 16 people. And then when they couldn't house 16, they dropped numbers to what they could house and who needed the most assistance. And then they had to drop numbers again just because it extended how long they could keep folks. So they're not housing anyone right now. They're back.
it seemed like things were calmer then. I mean,
Yeah.
So I think we can say that it was much calmer than the
Yeah.
low barrier shelter.
Can we go ahead and ask the group that was coordinating that to provide us with summaries of how many people total, how many nights, outcomes, like how many, because I think they did keep those statistics, and it seems like that's a desire from several of us to know what happened here when we attempted it. And then also, what were the barriers? I mean, obviously funding, but what barriers did they see, or what lessons did they learn in the process of doing it?
And y'all are talking about in Maggie. So
Yeah.
Casey is
Jesse
I'm just saying Casey's on the call, so I didn't know.
Yeah.
I don't want to put you on the spot, Casey, but let's see. Hey, we can barely hear you, Casey. Let me try this.
really loud. I can scream.
This one's doing absolutely nothing, right?
I can chat. I can put stuff in the chat box.
Hey, Casey, do you have my phone number?
I do have your phone number.
Will you just call me and I'll, that's probably a better speaker.
Okay.
If I don't get feedback.
You would think.
Oh, on the bottom. Well, I didn't think about that. That's very obvious.
Where are we at? Am I calling you?
Yeah, yes, Casey, if you don't mind.
It's not. It is all remote control. Wow. Wait, there we go.
Did you get it?
Yeah, can you see?
Oh, Casey,
Can you hear me now?
I don't push it all the way up.
Yeah, that's fantastic. Thank you, Alderman Sutton.
Okay, so we'll just stay here. Okay, so
All right.
what would we like to talk about? What are we talking about?
So there were some questions as we get ready for winter and the preparation. We would like to learn from your all's efforts with the low barrier shelter in Maggie Valley. We don't want to put you on the spot today, but we were wondering if we could get some data about how many people were served, how many nights you provided, maybe general outcomes, lessons learned, the cost.
Okay, and so I can give you that's really in depth, and I think, so I think that I can get with Jesse Lee and Lauren Wood and Bill at the Open Door to kind of get that, and Becca. They have a lot more of that information. I'm more of a facilitator of funds, but I think that going forward, it would be a good idea to go ahead and start talking to some of the hotel owners and see. I know especially with COVID, the occupancy percentages are down. And one of the main concerns that we heard when we started was they're going to destroy the rooms. And we only had one $40 damage charge. So I think that could ease a lot of hotel owners' minds. And then it would be more sustainable as far as funding, because we were paying a full rack rate, because we were just, needed to do it, needed to be done. Mm-hmm. And so if it's okay, I will send an email out to those people, and they're the people with the plan and the data. I'm just the loud mouth sometimes.
Silly question.
There was a question.
Was that facility for sale?
So Casey, there was a question if that facility is for sale.
Yes, it is for sale. And and we've had lots of discussions with him, and it's a pretty decent location and it's a neat setup. So it's for sale. All hotels are always for sale, always. I've never met a hotel owner that wouldn't sell you their hotel. So, but his is definitely for sale. It's not on the market, but it's him and his partner, but he is willing to talk about it. So,
so Casey, if we're not putting you too much on the spot, there was a question of whether you could share a specific dollar amount that had been discussed, or if that's not a comfortable conversation to have.
To buy the place. So his first initial price was $1 million. And then just based on occupancy and experience in tourism, he could probably get $1 million for it, but he had offered it to someone else for $750. And so the last time we talked about it, I told him that, I was looking at around the 650 mark, 650,000 mark.
Casey, do you know how many rooms?
21. it's 21 rooms, and it also has like a apartment in the center that could be either used for people to stay on site to help kind of navigate those that are staying there, or it could be broken up into apartments, and there's area in the back that could be used for some things. There's some space out back too. So we'd even talked about maybe doing like little tiny houses, campers, tents. Some people don't want to live in a home, and that's okay. So there's that too.
Any other questions for Casey? Well, Casey, we thank you for letting us put you on the spot and answering our questions. And I'll follow up in an email or phone call about, okay. We appreciate you. Oh, I may have lost you. Looser.
Am I muted?
Yeah, we lost you there for a minute.
Okay, but I'm back now.
You are back.
Okay. So yeah, so there's just several individuals that are on like a homelessness coalition, and yeah, they can get you all of that data and all of that stuff that you need for that. So it was kind of a neat little trial run to kind of break down some of the worries that people had in doing that, and watching people just after getting in bed with no judgment, no strings attached, just let them sleep and eat for a couple days, how much it changed how their perspective, how they interacted with other people.
Thank you, Casey. Of course.
I just wanted to say, I talked with Jessie Lee about that shelter, and she, it was like, she was talking about trying to buy it if she could get a grant or something. But the good thing about that shelter was, you've always got the not my backyard people, hear from them all the time every time we try to do something new. But what was good about that shelter was there's space for somebody to stay there and manage it. And then there was law enforcement presence that basically had that group in one area that could keep an eye on it. Because I'm not saying there was not any issues, I'm sure there was some, but law enforcement was there, they knew where they were, and if law enforcement was called out, they were there, and they could take care of something kind of in a confined area. So I didn't hear of any problems with tourism, if you will, while that was going on. And like I say, I feel like it was calmer in the area. I didn't, I just my feeling is that I've got a business in Broadville, so but it just seems like that was a kind of like a trial run, and it was probably, COVID basically forced us into that, and I think maybe some good positive things are going on with that. But she was going to try to maybe look about getting a grant or something like that, because that would probably be something that we could really hang our hats on, I think, in the future, if we could do something like that. Maybe the governments and private partner could partner and try to get something like that going, because when you have you have law enforcement, kind of keeping an eye on it and everything. She had a good relationship. Jessie had a good relationship with Maggie, and everything just seemed to run pretty smooth. For the idea that, oh my gosh, this is going on here. It wasn't really that. It basically helped people, and I know she got somebody was going there that they got in, started working somewhere. So I mean, it really helped.
Yeah. Did you all hear that through Zoom?
Yes, we heard that. That
Thank
is
you.
Accurate assessment, Kevin.
Any other questions or discussion points coming out of any of the work group reports?
I have a discussion point that economic stability talked about having a point in time count, and one of the business owners was saying that from his perspective, there could be a benefit in doing it before it gets cold. Thinking that there might be more, I'm not exactly sure all of his rationale, but that some people go to Florida, that we could perhaps have a higher number at this time of the year. So I think that's worth either us talking about on a small team again, because I think it's quite a bit of work. I've never participated in one, but I've talked to others who have. So I just think being strategic about whether it's worth doing something sooner or, because the January one is gonna happen regardless. Is that true?
Well, that's federal. That's across
That's
the
federal,
United States.
right.
You have,
Mhm.
you participate. The
Yeah.
thing about the one in January is that's how the COC, which is for 7 counties past Asheville, get any funding for rapid rehousing. So the higher your number of homeless, the more rapid rehousing funds. The misnomer with that is that we get shelter money for that. We don't. So the number of homelessness in no way helps shelter at all unless you get ESG funding, which we don't. It is quite an undertaking because like
Yeah.
for that point in time count, that's all of Haywood County. So that's not just Waynesville. And you also have to take into account, you would probably need to really coordinate with Harm Reduction Coalition because they're going to know where more of the folks are that you can't see.
Yeah.
That are homeless, that aren't in front level, or not at the shelter. Because they're working with folks that are floating around and maybe couch surfing one night and outside the next night. So you would need volunteers, and you'd want to be really safe about it because you don't just want to walk into the camp that is behind Walmart with nobody and just surprise them, because that's going to go really poorly. The other thing about point in time count, the federal one is they changed it this year, and in the past you actually had to talk to the person and document. But if you drive and you're passing a camp and there's 7 people outside and that they clearly kind of was there just fine, you can count those folks. You don't have to go say, hi, what's your name? You get all of that information. You have to log that that's how you counted them, that it was visual and there was no actually information exchange, but they can be counted that way too. The biggest numbers I can tell you in Haywood County for homeless for the yearly point in time count is the shelter. Open Door participated, Community Kitchen participated, and I think Harm Reduction did some. But finding the folks that are unseen is really what needs to be done. Because there were over 400 homeless kids in Haywood County counted through the school system last year. We can't use them for our point in time count because we didn't actually go talk to them on January, whatever it was. It has to be on that day. So you're with the point in time count now, you're getting, say it's January 15th and Pathways has 60 on the adult side and 10 moms with 18 children on the other side. That's where the bulk of your numbers are coming from. So also, yes, it probably would be helpful before it's cold because a lot of those folks that you see outside kind of disappear and find out that they're still in the county mostly, but they find places to congregate together, abandoned houses. Sometimes they have family members that'll let them stay one night and then they jump to another family member the next night, or jail. Sometimes, and I've heard it all the time in cold weather, I'll just go get a bed in jail. I can do something and have somewhere to stay. And it's not anything really malicious or they didn't burn anyone's house down, but it's something that they knew that they could get picked up for just so they had something. So it might be a good idea to see if the jail could give numbers of people that report being homeless when they come in, because you could get a good count that way. We have peer supports in the jail that work with transitioning people from jail to having a plan for discharge. And we could probably help you with numbers 3 and 2.
How many known encampments are in Haywood County? Is there 9 or 10?
That's probably a better question for law enforcement than me, because they probably have called there more than I would know.
Yeah, of course.
I was trying to throw it to you.
I asked some of our guys last week.
Travis, I'm sorry, before you speak, can you all hear online? Julius, yes, please continue.
I asked a couple of our guys last week to just as they came across encampments or new to let me know so I could kind of map those things out on, and that's just inside the city limits of Waynesville. And that we know of around 6 at this point. That does not include a van we just had removed this today, actually. We had 2 individuals living in a van that was parked on Wall Street. I wouldn't consider that an encampment, but I would. They were basically using it as a home. That being said, it's typically the same spots. We may go there and they really like behind Walmart for some reason. And we may clean that up and then they'll be back next week. There's other locations such as between Westwood Circle and Hickory Hollow. There's a greenway there. That seems to be another location that is somewhere they like. And then all the way out on the other end of town where the rec center's at, and underneath the bridge on Howell Road, the new bridge there.
Hey, sorry. I'm really uncomfortable with like giving out all of those locations. I don't really know who all's on this call, and I know that there's some people that would try to hurt them. I know that's not your intention, but just I think going forward, like if we're talking about locations, we need to be really careful because somebody on this group could say something on Facebook, not with malintent, but to just say, oh, well, they're here, they're coming from here. And there are people in our community that will go in at dark and hurt people or destroy their stuff. And I just don't think we need that element. So if people would just be aware of that when they're given locations.
We'll talk about it. Yeah, talk about it. So.
I disagree with that.
I've never heard of that happening.
I think we need to know where they're at so that the people live in the area can watch, maybe help law enforcement. I mean, that's the thing about it. Law enforcement is a small community. So I think it needs all the help they can get.
Casey.
Yeah, and if you're a trained law enforcement officer and you're going in to protect and to serve, that's fine. But when you are a community member that has a certain layer of bias and doesn't understand where people are at and blames everything on homeless people, and you're going in and you're tearing down the only thing they have, and you're tearing up their tents, and don't tell me it doesn't happen, because I've had people come to me when they've had their camp destroyed, and I've had to go out and I've had to get money to get them another tent. So all I'm saying is that it does happen, and that we need to be careful, and that we are here to protect these people, to protect our community. And so you may not agree with that because that's not your experience, and I understand that. But my experience has been that people in our community will go out there when they're not there today during their jobs, even though people don't think they work, and they will destroy all of their stuff. And then I will have to go on Facebook and raise $200 to go buy somebody a new tent. So what I'm saying is just be cautious when you go out. This is privileged information. You were on a task force, and I hope that nobody in here will say that, but I've seen some interactions on social media with people in this group, and I just don't trust some of y'all. And so if some of my people get hurt, then we're going to have a problem there.
Hey, Casey, it's Tyler.
Yes, I know. I'm not saying you're doing it, Tyler. I appreciate you, and you're coming from a perspective of helping people. I just want people to be aware.
You gotta let us know so we can handle it. Because I promise you, if somebody does that crap, excuse my language, I'll go handle it personally. We're not going to sit there and let somebody destroy somebody's home. That being said, in this task force, we've all signed a lot of you guys have signed a lot of paperwork, and if somebody goes out and does something, we'll handle that. But we've got to be able to talk about it productively. I had no intentions of putting that information out so that somebody would go destroy somebody's tent.
That's not directed to you. Like
I want to let you know that if that happens, we need to know about it so we can go handle it.
Right, and you will be the first person I call, but at this juncture, yeah, we'll see what happens. We'll do that.
Yeah.
I'll call you, see what happens.
So Julia.
I just want to add that all the meeting minutes and this meeting is recorded on here on Zoom.
Right.
And the meeting minutes are listed publicly on the website. And so once we document something, we have no control over who has access to that information. So I just wanted to back up Casey. I understand that we need to talk about it, but in the interest of protecting people's privacy and safety, I tend to agree that maybe if we're going to talk about specific locations, that's a separate conversation.
Yeah, I think that,
We don't talk about it, right?
so just, yeah,
I won't say any specifics. All I was getting at is this, that we know where they're at. We know these individuals. We actually have really good relationships with a lot of these individuals. I personally got out with about 8 of them just in the last week to talk to them, see what their story is, why they where they're at, how can I help you? And genuinely, yes, it is. I just need somewhere to go. One gal, she can't make it to her doctor's appointments because she doesn't have somewhere to stay and she doesn't have a roof over her head. So yes, a low barrier shelter is going to help her transition to that. For us, we're not going out, I can assure you, and I probably speak for the sheriff as well, we're not going out trying to arrest people that are homeless. We actually are trying to come meet them where they're at and try to be that conduit to get them to those wraparound services that exist. Now, that being said, when they do commit crimes, we're going to have to deal with that and handle that. But not all of these people that stand it down in Frog Level are, number one, from out of town, nor are they criminals. They're simply, some of them have homes within 100 yards of Frog Level, or they have somewhere to stay. But because of their substance abuse, they can only stay there one night and mom kicks them out. Or they just don't feel comfortable being in a home. As crazy as that sounds, they would rather be in a tent. So I think it's understanding each one of these individuals, because they're all different. Every one of them are different, have different stories. And as cumbersome as that sounds, that one-on-one that you guys know much more about than I do, because they come there and stay there. That one-on-one and find out, okay, what's this person's problem? How can we get them in the channel that they need to be in so we can help them get out of the cycle that they're in? I think that's the overall reason why we do need to count, I would say, in the next 4 weeks, because it will change. There are some that will leave and go to Florida or warmer weather. There are some that we won't see because they will find a place to go and we won't be able to find that encampment, so to speak.
okay. So I think there are valid perspectives on that were shared. If it's okay, I would like to follow up both with Tyler and Casey, if the 3 of us could connect and maybe work out what is an appropriate level of sharing. How do we do this in a way where the task force has the information it needs, but we also protect people's privacy and confidentiality? I think we can figure out a way to do that. So if I could connect maybe with the 2 of you together. Thank you. And thank you all for sharing. It's obviously we want the information for us to be able to respond effectively, but I think we also would all be very sensitive that we don't want to put anyone in any harm or danger. So I think we can figure that out. It seems like a next step for us too is to figure, do we work with the existing point in time count, or do we try to do our own? Again, I see valid perspectives on both sides of that. It is that, as I think Carrie adequately explained, it's a huge undertaking. And so time, resources, coordination of volunteers with COVID added in. So I'd like to follow up maybe with Jocelyn to see what y'all are hearing in your, okay. And maybe at our next meeting, which is just actually in a couple of weeks. We've got a pretty quick turnaround between this and our next meeting. I don't think that delays us too much. So does that sound like a good way to move forward on both of those issues?
Ugh.
Okay. Yes, John Lynn?
Yes, I raised my hand to say I want to be in the conversation. I have been one on my own for 1 year solid in a month to go out into the homeless communities, encampments, wherever they slept, wherever they stayed, wherever they hung out. I've done this for almost 1 year solid every week, 2, 3, 4 times a week to talk to the people that were there, to ask them, you don't have to tell me your name, you don't have to give me your birthday. I just want to know, how can I help you? What got you here? Is there anything that in the world that we can do for you to help you get out of this situation? I have not been in danger. I've been scared at times, but most of the time I was welcomed, and I was told by, I have figures, and I don't have them in front of me because I have recorded them, but I will say 75% of everyone I talked to said, I like my life, this is what I want, and don't bother me. Okay, so that's that. So I've been to the homeless encampments all around Waynesville. I know where they are. I'm not trying to harm them. I'm not trying to hurt them in any way. I was trying to help them. I took them food, fruit, fresh vegetables that they could eat at the time, that kind of thing. I just want to say that we're not on different teams here. We're on the same team. We're trying to help a certain amount of people, a certain project of people. Some of them want different things than others. Maybe we keep talking about low barrier homelessness shelters. That may all be well and good, but I can tell you, I have a record, and it didn't happen just yesterday. It's happened over almost a year, that these folks do not want the low barrier homeless shelter. They like what they have in their life. Some of them have lost their jobs. There were different stories. Some were unemployed. Some couldn't get back on their feet. I understand that. But I just wanted to make the point that nobody's trying to hurt anybody. Nobody that I know, that I'm involved with in Waynesville, in the town of Waynesville, wants to hurt anybody. We all know these people have value. We know they're human beings. We know they have problems, drug addiction, mental illness, whatever it may be. We all know this, okay? We're trying to help them, but I don't know anyone that's out there trying to hurt them and in any way. So I just wanted to make that clear. Thank you.
Thank you. Carrie, you wanted to respond?
I do. Can I take my mask down? I'm not sure.
Oh,
Sure.
I bet.
Yeah.
Okay. So I think part of that is, I think that even with John Lynn's information, it's still necessary to get a better count, because homeless folks move around a lot from place to place. Some of those people could have been double counted. We don't have figures on exactly who those folks were. I appreciate the work that she did doing that, but I think that there might be more people now, especially since COVID, that weren't homeless before and are homeless now. Also, that doesn't encompass the populations that I spoke about earlier that we don't see, that we don't have numbers on, that are incarcerated, coming out of incarceration, bouncing from family member to family member, kids. If there were at least 400 kids last school year, imagine this school year if they had an accurate count of what those numbers would be. So I think we'd be missing an entire subset of the population. And I agree that the conversation should happen with Tyler and Casey, because I think we need this information. I think it's super important. If we can't talk about it, we can't get anywhere. But I will say, from Casey's standpoint, I've had homeless folks show up at the homeless shelter who had no intention to stay there, but they needed Band-Aids and ointment because someone did burn their tent. And so I was providing kind of like a crisis service that I'm not even medically trained to do, because they were terrified to go to the doctor and they had lost everything that they owned. Did I have a sleeping bag? So I don't think that maybe Casey was saying that John Lynn or me or Anthony are necessarily malicious. And it could have very well been another homeless person that did that, or an accident and it happened and it was no fault of anyone's. But things happen, and we don't know who is looking at the information that we're discussing, because it is public record. So I think that there has to be some sort of middle ground, because I mean, only law enforcement would have that information, and if he can't share it to the group, then we can't.
Mm-hmm.
So.
Yeah, and I think we all agreed from the beginning that the data is so important. We may have our own individual experiences, but trying to figure out what is happening across our community is really important.
Wasn't that one of the items that was first brought up
Mm-hmm.
in the first meeting we had?
Yeah.
That all this information will be shared amongst the group and it will be public record, and my understanding correctly, sorry.
Because this is a public, it is, the task force was a town task force, then everything is public.
Correct. I remember filling out the.
Now we can get the groups together to discuss between themselves to try to, and then disseminate it to the rest of the group, but it's all public.
Right, and I think that the public's the ones that really needs to know, so they understand what the issues or potential issues are. I mean, officer, you know, the ones that PD, the sheriff's department's not, I don't think, they're not going out there tearing stuff up. I'll shut up.
Yeah, that's not what I heard, Dale.
I know that's not, I don't want to get on the soapbox.
Yeah. And I will just share, you know, I, as an academic who is associated with Western, I also have to follow human subjects protocol. So there's a difference in my world about aggregating data and also in data about individuals that can put people at harm and risk. So we can talk about how can we still get the data that we need, but not put individual folks at risk and harm. Yeah. Yes, Hannah.
I think that answers my question, but just hypothetically, if the task force working group did decide and people all came together to volunteer and do a point in time count, we could report those numbers without reporting names and locations.
Right. Yes. Yeah.
I think it would be wise to have a count of males, females, children, if we're going to go that direction. But yeah, I don't think you have to be non-specific. Even for the federal point in time count, you don't provide where they were staying, except you can say shelter outside, place not meant for human habitation, that type of thing. And if they'll complete the survey, you can ask things like domestic violence and substance use so they can get an idea of those numbers, but there's no specifics that you have to provide.
Yeah. Yeah, we'll explore that a little bit more. And I agree with Kara. I think there's a middle ground we can find there. Okay, so again, we need to delay on our agenda. Chief Adams, we were waiting for you to rejoin us to have the discussion on the definitions of homelessness. I think the conversation we had here today was one we needed to have. So I no qualms about spending our time in that way, but that's still an important aspect of how are we going to define that. So I'll keep putting that on the agenda. You have some of the proposed definitions in front of you. We do not have to follow those definitions, but as I've said before, there's some pros and cons to not following those standard definitions. Most funding is associated and tied to with being able to document folks in that way, but in some ways they're also, they can be limiting and exclusive. So as Carrie is talking about the invisible folks that we just don't know, the definition of homelessness sometimes does not include those individuals. So I'll let you look over that handout. We'll put that on the agenda for next time as well. So working groups continue to meet. I'll continue to check in. Let us know if there are any particular ways we can support any of the work group efforts. Our next meeting is 2 weeks from now. I'm sorry, I don't have October the 8th. And then we were going to have a discussion at that meeting too regarding the frequency of the task force meetings. Now that we're getting the work groups up and going, does it still make sense for us to also meet 2 times a month, or do we want to move to having a task force meeting once a month and your work group meetings once a month. So we'll have that discussion at the October 8th meeting. And I also would like to put on the table, I thought 90 minutes was going to be enough for us. But if we are meeting only once a month, if we do move that way, I do want to put on the table maybe a 2-hour meeting, but I'll let you all have that discussion. You know, I think there are very strong feelings on both sides of the conversation we had tonight. From my perspective, I think everyone remained respectful and focused on the issues and did not personalize this issue. Others may have a different perspective of that. But, you know, there are probably going to be times more often as we move forward. I do think we are all on the same page, and as folks articulated, want the same goal. But we may have different ideas about how we get there. So we'll remind each other of our agreements with one another. But these are serious issues, and I think we allow the time and space to explore them. So I thank you all for your commitment. Hannah, did you have a wrap up? Mm-hmm.
I've seen it happen before where there's working groups working on the same things and not communicating. And
oh, yes.
I think that I just wanted, and I've heard Carrie talking about some data that like we're talking about too in the winter stuff, and those connections are happening, but I think there's an email with all leads on the same email, probably. I think, or if working group people don't have others, I just think that's a good idea, so we're not doubling up work and we can collaborate.
Yes, thank you so much for raising that point. I had intended to mention tonight, I wanted to ask you all if you were okay with me creating a shared Google folder for all of us so we can be uploading work group reports, have a repository, have contact information where people can reach out. We don't really have enough time to discuss that. I will send that in my follow-up email to you. And if anybody has a strong feeling about not creating that, we have the town website for the official minutes, right? Documents, all of that. But that Google Drive might give us a space to connect and strategize on a different level. So I'll send that out in an email if you'd like to send your thoughts back. But Hannah and I can start creating that infrastructure. Thank you, Hannah. That was on my notes and I forgot to mention it. That's my right-hand person right there. Okay, I think that's a wrap then for us tonight. As always, I thank you for your time and commitment, and we'll see you on October the 8th, if not before, in a work group. Take care.